Welcome back to On the Beat, everyone. I'm over here with Dr. Cameron Huxford from the Huxford Clinic, and we're talking all about sleep apnea treatments other than CPAP. How are you, my friend?
Doing very well, thank you.
Okay, tell me to begin with, what is sleep apnea?
Sleep apnea is when you quit breathing at night while you sleep.
How dangerous is that to our health?
It can be very dangerous, but usually it just affects your daily life, maybe more fatigue and just not enough energy rather than significant health problems.
It becomes a restless sleep, doesn't it?
Very much so.
All right, explain to everyone at home, if we may, because we've had you on the show before. What is CPAP?
CPAP stands for continuous positive airway pressure, but it's the mask. Everyone's familiar with the mask that people wear for sleep apnea, and that's what that is.
Okay, well, what is other treatments for CPAP?
There are some surgeries that are...
Oh, really?
Yeah, they're not... most people don't opt for them. They can be quite brutal, but they are very effective.
Well, let's talk about that a little bit, for if you wouldn't mind.
Yeah,
when you say they're quite brutal, it's something that I'm interested in hearing more about. What are they doing surgery on?
Yes, well, one is done by an ear, nose, throat surgeon.
Okay.
Where they go in and remove part of your soft palate and your tonsils and the uvula, which is the little hangy down thing in the back of your throat. That one's tough to recover from. It's effective. And then the other one is done by an oral surgeon, where they will go in and fracture your upper and your lower jaw and pull them forward and kind of just restructure your entire face.
Seriously?
Yes.
That's quite dramatic with what you're saying.
They are considered curative, especially the oral surgeon procedure, but it's a lot to go through.
I was going to say, do you think that's last resort?
It is. There's
for a severe case?
Very much so.
Who has sleep apnea?
Anyone.
Really?
Potentially anyone.
Because I thought I had it.
Yeah, we see children, and then we see old people like yourself.
You just say old. But what about unhealthy individuals, maybe overweight, people with obesity?
It is common. Weight does influence it, so the more you weigh, the more of a chance you could have sleep apnea. And then people with diabetes and high blood pressure and a history of heart attacks, they should all be tested too.
Okay, all right. Now, we've heard about the CPAP for the face, okay? There are mouthpieces out there on the market available as well. Do you recommend having one made for you or buying one over the counter? Let's go through those.
That's probably the most common therapy other than CPAP is an oral appliance. And it's not the ones that you see on TV that you order it and boil it and make a mold with your own teeth. The ones that we use to treat sleep apnea are made by certain dentists and oral surgeons.
Okay, now does that come from recommendations from people like you?
Oh yes, that is in the recommendations for the treatment of sleep apnea.
Okay, so I just want to walk through the process, if I may. I come in, I'm thinking I may have a sleeping condition, all right, sleep apnea. What's that process?
We would talk to you about your symptoms, and if we think that you do likely have sleep apnea, then we schedule a sleep study.
How do we know, or how do I know I have a sleep apnea symptom?
The most common symptoms that bring people in would be excessive tiredness. No matter how much sleep you get, you just feel tired, or you toss and turn and you don't feel that you get restful sleep. And then the other two main symptoms come from usually someone you share a house with or an apartment with, your spouse, a friend, and that would be loud snoring, or they say, hey, you quit breathing at night.
Well, that's not too funny to laugh about, but I mean, having the person nudging you behind you is always a good thing. Hey, buddy, we appreciate you. We've got so much more to talk about.
Thank you very much.
If you think maybe your loved one laying beside you has sleep apnea, or maybe yourself as well, give this wonderful man a call. Dr. Cameron Huxford. All the information's up on the screen, everyone. The Huxford Clinic, back after this short break.